Good evening. Welcome to another edition of Focus with Tim Thomas. We're coming to you from the beautiful Baptist Health Campus here in the city of Madisonville. And we hope you will let someone know that this program is being on today. We're here joined by none other than my good friend, Mr. Cameron Edwards, who is Business Development Manager for Baptist Health. And glad to have you with us.
It's a pleasure to be here.
You know, a lot of exciting things taking place here at Baptist Health, and we want to try to fill in all of that 30 minutes, so there's so much to talk about. But first, tell us a little bit about yourself, Cameron, and coming back to this area.
Certainly. I'm from this area. I grew up just down the road in Webster County in the big city of Aunton. My family's all there, and went away to school. Was fortunate enough to attend Georgetown College in Central Kentucky, and met my wife up there in Central Kentucky. And after a few years of career chasing throughout the region, we decided to make the move to come back to Western Kentucky. And lo and behold, there was a job waiting with a hospital of all places. My wife she's always been in the hospital in her career as a nurse and then as a nurse practitioner, and she's currently does both with Baptist. So that was no surprise that she would end up there. But I think when I wound up in the hospital, a few heads turned. They said, "What in the world's he going to do there?" But they have welcomed me with open arms. They have given me a platform to do what's most important to me, which is to give back to our community, to serve our families, and make sure that we're making an impact somewhere. And the foundation was the perfect opportunity for the marriage of all those things, and so I couldn't be happier being back in this area.
Well, I tell you, you certainly have made a difference since being here in the portraying what our Baptist Health is doing and putting out a good picture of some of the great things that's being taking place.
You know, this institution has been affecting lives for decades. It's touched each and every one of our lives for those of us that are from here. And you know, once you go behind the curtain and you see how much truly goes into the operation of this place, and all the individual efforts given by our staff at every single level, it's no surprise that they don't have enough time to toot their own horn sometimes, which is fantastic though, because it gives me the opportunity to go out into the community and to share both the things that we have going on, the new initiatives that we have going on, but also to tell about the individual stories of just care and commitment and excellence that our staff brings to this facility. I mean, we tend to overlook the value of what we have in our own backyard. It doesn't matter if it's a hospital or a school system or your favorite local restaurant. Sooner or later, you can find a niche, a chink in anyone's armor. But the truth is, we have so much to be thankful for, and having this facility here, having the variety of services that we have here. For me, without this hospital, it's over a 30-minute ride to the local ER. And if something were to happen to myself or one of my children, I like having a place 10 minutes up the road that's not only able to care for them immediately, but able to care for their long-term needs as well, should that be necessary. Pray that never happens. But it's good to know that we've got great people and a really good facility here to take care of them.
Absolutely. We on yesterday, since we're now filming this the day after, you had a Reconnect Day, Reconnect Business Day in the community.
Yep.
Tell us a little bit about that and how that went.
So we are obviously very involved in our local business community. Our hospital is a tremendous economic player in our region. We touch so many different types of businesses, but we've been discussing lately the variety of ways in which we need to go about reconnecting with some of our local partners, reconnecting with their staffs on an individual level. Our focus was to pull together some key folks in some different areas throughout the hospital to try to develop a plan of re-engaging some of our local partners. And yesterday was the culmination of all that planning and all those efforts. We visited over 50 local businesses yesterday. Over several hundred individual staff were given prizes and
Wow.
little giveaway items. I know we gave out over, I think, 600 cookies
Wow.
at different locations. Some of those may have fallen off the truck in our own little pass out groups that we sent out.
Mm-hmm.
But I think the bulk of them did make them to the to the folks that they were supposed to go to. But at the end of the day, yesterday was about two things. It was about getting our people into the community. Some of our staff, some of our new providers that we have, were part of that, and they're new faces to the community. They're young doctors that are making the conscious decision to build their lives and their careers in this community, and so we're doing our part about getting them out there, introducing them to local businesses, and that builds relationships. That turns into the let's go have a lunch. Let's come visit my church. Let's interact on a social level in some way, and that helps so much in our doctors feeling like they belong here, and that there's a place for them here, and that makes them want to stay and become part of the community long term. As you know, healthcare is a very challenging climate as far as there's so many needs and only so many resources. So recruiting great physicians and great skilled staff members here at the hospital is always going to be a priority for us. And initiatives like yesterday, when you have those doctors that are willing to get out and really walk the pavement and get to know people, it goes a long way. So connecting with the businesses and saying thank you was the biggest thing.
And that goes a long way.
Yes.
Just a word of thank you is such an encouragement to businesses and to people in general.
Absolutely. It doesn't matter if you're what area you're working in, you want to feel like you're appreciated and that you're valued. And so for us, we utilize every single one of the businesses that we visited yesterday in some capacity, whether it's on a personal level by our staff or through the engagement of our business here at Baptist Health. We really all connect, and so saying thank you was the most important thing. The second element of it was to make sure that the community knew about an event we're having coming up. It's a special heart and vascular fair that we do every year. It's just one of many very important outreach activities that we do in terms of serving our community. Millions of dollars each year go into providing care and assistance back into the community, in providing reduced fees for patients that have difficult challenges financially. And those rarely ever make the headline. Telling those stories is not something we promote that much. But when you talk about significant impact, part of my job is sharing those areas where we're most impactful. And I would say that giving away echocardiograms and EKGs to folks that need it is a pretty impactful service. And that is kind of the push by our Heart and Vascular Center. The Hammond Heart and Vascular Center here at Baptist Health serves numerous patients throughout the year from our whole 11 county service region. And so making sure that folks knew that we were going to be offering those special services for that event was important.
That's good. That's good.
The two kind of coming together really worked well. One of the value points we included in this initiative, though, on the same flyer that we have that announcement about the Heart and Vascular Fair, we also included a health risk assessment tool and promotional tool for each of the businesses. So if you're a local business leader and you're caring about the health and safety of your staff, we give you a tool that you're able to distribute to your staff that says, hey, when you're in your 20s, these are some health things you might focus on. More wellness-centered activities that you should be doing. In your 30s, I know when I turned 30, I found out I was going to be a dad, and all of a sudden healthcare became a whole different thing for me. I went out and got a doctor. And what you find out is about that time you start some standard tests start
Sure.
becoming more common, and then you hit your 40s and 50s, and if my experience has told me anything, they feel like it's always something. And I'm headed there quick myself, but at the end of the day, we all have different levels of health needs at different phases of life. And so that document really helps to kind of put some things into perspective and let you know what those important
Sure.
milestones are in care. But it also had an interactive health assessment tool, which you can find on our website at Baptist Health. It allows individuals, maybe you're concerned about your cardiovascular fitness. It'll allow you to go in and actually take an assessment geared specifically for treatment of that area. And the beautiful thing about that is you walk away from that knowing your risk level. If it's something you're comfortable with, you're at peace, you can move on. But if it's something you still feel uncertain about, it also gives you the opportunity to connect with a Baptist Health provider right there in that moment. And that's an incredible advantage because, a lot of hospitals and a lot of different locations around us, appointment times are challenging.
Sure.
But that's one of the great things about where we're at right now. We're adding staff. We're growing our patient providers so that we can make sure people are getting access to the care they need in a timely manner, because that's important to us.
Very much so. I know that you head up the foundation at Baptist Health, something we're both interested in. Tell us a little bit about the foundation, how it's going.
The foundation is the supporting arm of the hospital. For years, folks in this community, this was the biggest enterprise we had in the region, and for years, it was the entity that really led the charge in support. But healthcare has changed. The world has changed in the way we process medicine, and the way insurance pays out, and the way different types of coverages are provided. All hospitals need our support. We truly cannot overstate that enough, and that's one area where I'll step across the party line, so to speak, and speak in support of every hospital that wherever you are, whatever community you're in, your hospital could use your support, because there are people there that need it.
Sure.
The foundation, is, in my opinion, the outreach arm of the hospital, in that we're able to bring together the resources of supporters in our community to meet the needs of our patients, to meet the needs of our facility, to live out our mission, which is to demonstrate the love of Christ by sharing the care and expertise that we have. And so we're able to do special projects throughout the hospital, things like providing sleep sacks for every baby that comes through this hospital, that's ever born in this hospital. Those safe sleep opportunities and the educational opportunity that's there for the parents because of those simple gifts is immense. And the value point there is that each person goes home feeling like Baptist Health was not only involved in their care, but they also made an investment in the future care. And we want people to know that we want to walk beside you throughout your entire health journey, from the moment your first child is born to the first time you start having those tests, to that first surgery that's concerning, to the challenging decisions that come when dealing with maybe a parent or an extended family member, and making difficult choices. We want people to know that Baptist Health is right there walking beside them and is a good partner. And so the foundation really tries to live out that mission. We do things, a variety of different outreach activities. Of course, we provide the teddy bears to every child that goes through and receives surgery in the hospital. The biggest thing we've done outside of providing assistance for special projects is our Rod's Badge at All-Inclusive Play Park. That really was the crowning moment for our foundation.
It was a good kickoff too,
yes.
wasn't it?
Well, when you think about all the people that's impacted already, I can tell you that it has surpassed our wildest expectations in terms of the impact that it would have on the culture of the hospital. If you drive through our campus, yesterday, it's mid-February, and there were 4 families out there playing on it yesterday afternoon.
Wow.
And the weather was nice, but it wasn't fantastic.
That's
nice.
right.
So it just shows you that facility is in the right place to serve people. So many of our guests come from far away. Maybe they're in a situation where transportation is not readily available, or there's not multiple modes of transportation. That 10-year-old child didn't ask to have to come sit at the hospital for 6-7 hours. So it's a great resource for mom to be able to take the child out, or dad to be able to take the child out, and just let them blow off some steam. And that doesn't even touch on the real impact of that facility, which is serving the needs of our children in this region with special needs. It really has not even ever materialized into that point, because it's there. It's readily available, and anyone can use it regardless of your ability, and that's how it should be. But it's in the best place to do the most good by being right outside of our pediatric therapy department here. We're the only facility in the region that does all phases of all-inclusive pediatric therapy. So for those kids to be able to go out there and do their treatments, to be able to get that extra time in, maybe they don't have the insurance that allows them to do multiple visits per week, but mom can take them out there and they can do the exact same activities as they do with their therapist, that one appointment a month. And it's such an important piece for access and availability. So I can tell you that project was a labor of love for every single person that was involved. Every organization locally that supported it. We had partners all across town, and it's funny, we had our chamber event the other night.
Yes, West Kentucky.
Yes.
Thank you, not.
Well, we had that, but before that we had our local Evening of the Stars event.
Yes.
And we were up for Nonprofit of the Year because we had a pretty good year last year. And we were in that category with our local YMCA and with the Hopkins County Young Professionals, and we were all joking kind of internally amongst ourselves about who would walk away with the hardware. But at the end of the day, each of us were just so proud of one another, because we're all partners.
That's
both of those organizations partnered in support of that facility. And so I was clapping just as hard for them as if I'd have won it myself. So I just think the trophy would have looked better in my trophy case.
I feel you on that one. You got some new doctors that at Baptist Health now. Yep,
we do. We've had some great new additions, building out our women's and children's services line, bringing in in the last year, doctors like Dr. Sarah Fisher, who's from here in this area. She grew up here. Those are such pivotal hires for this hospital, because it's about having a young physician with so much promise and so much opportunity to be able to come back to an area like this and want to build their career here. That's the lifeblood of an institution like this. Dr. Abigail Weisenberger is there, Dr. Christopher Squires. Those were two other additions that we had in the last year, and I tell you, we've got a powerhouse team for women's and children's services now, along with a couple other providers that I'm failing to mention. And then in terms of our medical group, most people don't make the distinction between our hospital and our clinic as being two distinct groups, but they really are, and they both are really targeted in their expectation of providing care. So they're constantly working to try to improve the way that they work and manage together. And that comes with the acquisition of new docs, and we've added, Dr. Brad Bilbrough, who's a new primary care provider across the way, and Dr. Kristen Wickham. Both of them are just fantastic. They have hit the ground running. They're exactly what we want in new physicians. They're exactly what I want in new physicians. They're competent, they're driven, but most of all, they have a heart and a passion for what they're doing. From the moment they stepped on campus, they have been involved when it was coming to our engagement night for our chamber after hours, to being a part of our Shop with a Doc program that we do, where we take children from the local family resource centers in Hopkins, Webster, and the Dawson Springs school districts. This year we took them shopping for their Christmas, and those docs were right there in the thick of it, participating, supporting, and we couldn't do it without them, and all the others that are part of that. But that's what you want. That is the future of healthcare in Madisonville, and really in rural areas. It's going to be finding those individuals who buy into the location, the culture, the atmosphere of people, and just want to be part of the mission of serving. And you know, we say that, as I said before, recruitment is such a challenging part of, you know, of a successful hospital nowadays. It's only going to get worse.
Sure.
You know, over the next 20 years, or 10 years, 12 years, we're going to see a need for 122,000 more physicians nationwide. And so all of these different networks are pursuing a new physician every single day.
Wow.
And what's going to be the determining factor between them and nurses, you know, in the next 10 years, we're going to see about a 25% availability rate for nurses based on the need. We're going to need 75% more than what we have.
Wow.
And it's tremendous field for anyone that's looking to make a career change. Nursing is the way to go. But they, you know, we're talking about massive need. And so it's not going to be the dollars and the cents that cause people to pick a location, because everybody's going to be competing in that regard. What it's going to be is, what is your culture of your location? What is the heartbeat of your institution? What do things like the foundation do that remind the staff that this is the place you want to live and give and care and raise your families? You know, we have such a tremendous leg up in that regard, in that our community has so many valuable amenities, things, you know, that just make a quality of life. I heard a physician say yesterday, you know, they could have gone anywhere, but they wanted to raise their family in a place where people said thank you.
Wow.
And that was Madisonville for them.
You know,
and that was a fantastic comment.
It is. And if you look at now, let's say the next 5 years, what do you see down the pike? What would you like to see be happening with Baptist Health in the next 5 years?
I think, and of course, I have to be careful here because I know some of the things that are coming next 5 years down the pipe. The next 5.
Make it an exclusive.
Yeah. Oh, I don't know if Baptists would appreciate me taking all the media coverage of that. No. I think Baptist right now is at the peak of something that's getting ready to just jump off. You know, we've went through the transition period of going from our previous health institution to being Baptist Health, and we've went through some of the growth challenges of, you know, becoming part of a system and gaining, you know, integration of resources is a challenge. When you try to make two businesses come together, to do that, it takes some time and some very understanding minds and hearts. And I can tell you, all around this place, there's people that have given extra time and extra energy to make the transition more seamless so that our patients don't have to struggle in any capacity. But we've made it through that time. And right now, we're improving every day. Things are getting better around the hospital in some of the business challenges. Every single day, we couldn't be more proud of our staff and the way they're operating. We're becoming more efficient in the way we're laying out the structure of our hospital. If you haven't been on campus in a while, you should come by because it's changed in a lot of areas. Our primary care tower, the Troller Tower across the parking lot, we've recently went through and renovated the primary care floors. So if you're going over there to visit your endo or your endocrinology specialist or whoever it might be, you're going to see new waiting rooms, you're going to see new services, you're going to see new physicians. So it's a great time to check back in, and I would tell you it's a great time to get on board, because we're not building a business model here. We're not trying to build anything like that. What we're building is a family, a family and a culture of support that when tough times come, people won't leave. And we've had that. You know, that's one of the beauties of having a facility with so much history here in this community. I mean, this is the hospital I was born in. And even though the name on the door at that time wasn't Baptist Health, it's still the hospital I was born in.
Yes.
You know, one of the things I love to share with folks is about our incredible nursing corps. Nurses, in my opinion,
received an award.
Yes, nurses, in my opinion, are the lifeblood of the hospital. They truly make things go and keep people in positions of care and comfort all day long. They did just receive their Pathways to Excellence designation again for the second year in a row.
Wow.
We're the only hospital system in the entire world that has every single one of our hospitals ranked in that Pathways to Excellence designation, which is incredible. But the big number I share is when you look at our nursing corps here at the hospital, we have over 5,400 years of combined nursing experience in this hospital. When you think about providing care and treatment and the number of road miles you've got to get to even make 1 year, and we've got, you know, nurses on our labor and delivery unit that have been bringing babies into this world for 40 years.
Wow.
It's incredible. And you can't, you know, they say the one thing you can't duplicate is talent. We've got it, you know, and so whenever you combine a new drive, you know, an innovative philosophy that's pushing to make things better, more efficient, and you pair that with, you know, the talent and the education and the skill of physicians and nurses and all of our staff, you know, you can't undersell our non-clinical staff. I'm one of them, and I give them a bad name, but the most of them are fantastic people.
Right.
But when you combine all that together, you've got the recipe for something special. And that special thing is the healthcare institution that's going to serve this region for the next 50 years.
Wow.
So
We're almost run out of time, but what would you like to maybe leave with the listening audience of some of the things that's going to be upcoming?
Sure. You know, some great activities coming up. We've got the Heart and Vascular Fair on the 29th of February. You can find information about that on our website and our Facebook page. I would tell everybody that if you're not currently following our Facebook page for the hospital, and also our Facebook page for our foundation,
We'll put that on the
please
screen.
do that. We'll we put a lot of information. We've got some great events coming up. We've got our time of remembrance coming up with our hospice group in a few months. We've got some more screenings related to colon cancer and screening and early detection for that that'll be coming up next month. There's always an initiative going at this hospital. So if you're going to be plugged in, if you're going to stay, you know, engaged on something, this is a great place to be. If you're looking for an opportunity to serve or share, the foundation is a great place to start, because we always need volunteers at the hospital. We always need supporters for special projects and initiatives. And if you have a heart for giving back to folks in the relative field of healthcare, give us a call at the foundation, because we can find a home for your gift that will make you proud and will make someone else fulfilled. So
we want to encourage you to do that. We want to encourage you to get hooked into Baptist Health, learn more about the great things that are taking place here. We're going to put on the screen a Facebook page for the foundation as well as for Baptist Health. Not only is it a great place to bring your loved ones when you have to, because of the great care you get, that goes without saying, but because of the sense of community that they each day gives out to everyone. I think it's important. I think it's important that we spotlight that as well.
You know, they say that I'm a big advocate for agriculture, and they say that, you know, you'll need different people at different times throughout your life, but every day, 3 times a day, you'll need a farmer. And that's as true a statement as there can be. But outside of that, I don't know if there's an industry or an institution that's more worthwhile of investing in and supporting than the one that, when you're in your moment of crisis, will care for your loved ones and will make sure that they get safely taken care of.
Right. That old saying that says that the greatest thing in life is to know someone cares.
Yep.
And that is really true. And here at Baptist Health, they care.
Thank you.
They care, and we appreciate you all. And not only are you a great Kiwanian brother, just had to put that out there for you who may would like to be a part of Kiwanis. You got a good one here. But also, you are a pastor as well, pastor 2 churches here in Hopkins County.
Well, one in Hopkins and one just over the line in Webster.
Right, yeah, just right over.
But about 32 weeks ago, I started the process of being a part-time pastor with the Methodist Church, and so I do get to do that in all my spare time.
Yeah. Tell us where your church is located.
Well, we're at Parkview United Methodist, which is located right at right beside Grapevine Elementary here in Madisonville. That's probably the easiest way to describe it. Great congregation there, a church with a ton of history. Blessed to be a part of that team and to give back in that way. And then my other church is Mount Pleasant United Methodist, which is in Slaughters, located on 138 between Slaughters and Dixon. Another exactly the same great church, small congregation. If you're looking for a church home, that's a great place to be too.
Well, we want to encourage you to stop by.
The best part about this job is it allows me to share my faith and serve in this capacity during the week too. So.
That's right, and it's not that's not a coincidence. Things happen for a reason, and God places people at certain places, certain times.
He's put a lot of good friends and great resources in my past since I've come back to Madisonville, and I can't say thank you enough to everyone that I get to work with. On the 20 or so boards and committees I get to be a part of.
I feel you. So we appreciate you, Cameron. Thanks for being on Focus.
Thank you very much for having me.
Invite us back when you've got something else you want to share with us. We'd be glad to come and
absolutely
talk to you about it.
Absolutely.
We've been talking to Mr. Cameron Edwards, Pastor Cameron Edwards, if I can say that. He is Business Development Manager for Baptist Health here in the city of Madisonville, Kentucky. Hope you enjoyed the program, and we hope you have received good information about what Baptist Health is. And again, we're putting all the information on the screen for you to see. We encourage you to be a part of the great things here at Baptist Health. I'm Tim Thomas. Have a good evening and keep sharing the dream.